Good morning again, everyone. Natalie Leek-Nelson from Providence House, and we're here today for the webinar to talk about crisis nurseries and the Family First Preservation Services Act. So we hope that you find this content helpful. Please feel free as we go through the webinar to type in questions. I'm going to kick off here with a quick introduction, and then we are going to turn it over to Annette Iwamoto, who is our Strategic Initiatives Manager and our in-house expert on Family First. So thank you for joining us. Please feel free to share who you are and the organization and community that you're from so that participants can see. And we'll talk in a little bit about opportunities for polls that we will be posting and feedback surveys for the webinar. As I introduce myself, I'm Natalie Leek-Nelson, the President and CEO of Providence House in Cleveland, Ohio. And joining me?
My name is Annette Iwamoto. I'm the Strategic Initiatives Manager. I've been with Providence House for coming on 7 years. Have worked in fundraising and in my role as Strategic Initiatives Manager, help with government relations, program evaluation, and some of the collaborative work we're doing with crisis nurseries and other organizations around the country.
Thank you, Annette. Just want to give you a little quick background for those of you that aren't familiar with Providence House. We were founded in 1981, so in our 38th year of operation. We are licensed through the Ohio Department of Job Family Services. We've served over 8,000 children since we opened our doors. We currently operate a 30-bed facility in Cleveland and are in the process of expanding to the east side of our city to add another 20 beds. So we'll be serving 50 children at a time. Various accreditations, as I said, licensed by the Ohio Department of Job Family Services. We are a behavioral health provider through the Ohio Mental Health and Addiction Services Board, the Department of Medicaid. We are CARF accredited, a member of our United Way and Community Shares partnerships as well in the community. So our goals today are really to provide the group joining us with an overview of the Family First Preservation Services Act, which was passed in the fall of 2018. One, to make sure that everyone knows what the Family First Preservation Services Act is and how it's rolling out and the implementation status for how it will move from the federal to your local state level, but also understand how the transformation of services aligned with crisis nurseries needs to be a discussion with a family preservation focus for our crisis nursery communities. And I know some of us do shelter, some of us do family preservation services, so Annette will dig a little bit more into what Family First is really looking for in qualifying programs. We'll also talk about the opportunity that Family First presents for crisis nurseries across the U.S. This is a federal act that can impact nurseries in every state throughout the United States. We also want to hear any questions that you have, hear perspectives from other people about how Family First may or may not impact you or your local community, and then talk about the ways that we can advocate together to continue this conversation and to hopefully position crisis nurseries in the federal clearinghouse and certainly within your own states as qualifying Family First programs.
Sure. So we have a couple of questions just to get a feel for who's in the room. So we're going to do some polls here. The first one is really understanding what level of understanding you have for the Family Prevention Services Act. So that's up right now. It looks like most of you have voted. And let's see if I close this poll, if you'll be able to see the results coming in. We had about 57%, a little more than half, saying that they follow the updates and understand the basics, and a little less than half saying they've heard of it but don't really know what it's about. So hopefully we'll be able to cover some of that today. And of course, if you have questions, use the questions or the chat so that we can see what those are, try to answer them. I will say that I have been following the legislation, have been trying to stay active in its implementation in Ohio. but I'm not an expert in all parts of it. It's pretty broad legislation. We're really going to be focusing on the prevention services part of it today. We want to get a sense of what other crisis nurseries are in the room with us today. So the first question we'd love to hear is what ages everyone serves in their crisis nursery. And you should be able to select more than one here. So I think most of us have voted now. It looks like everyone serves the ages 0 to 3, 4 to 6. I can only do 5 options, so I know that some of them, the cutoffs might be in between these age ranges. 80% or so of us are going to the ages of 10, a little bit further going into ages 11 to 13, and just about a third going up to the age of 17. Providence House here in Cleveland, we can serve up to the age of 12, but the majority, 70–80% of the children we serve are in that newborn to 5 population, and the older children tend to be siblings of that younger sibling set. I'm going to close this poll. Our next question, what is your closest to the longest length of time that children are able to stay in the nursery, in your nursery? Right, looks like most people have voted, and it shows 62%, majority of us in the room, 72 hours or less, 14% for up to 14 days, 14% up to 30 days, and 10% up to 90 days. So here at Providence House, we're able to serve children for up to 90 days. Our average length of stay does tend to be about 3 to 4 weeks, so a little bit less time than that. But we really advocated in Ohio to allow us to go up to 90 days to support families who might be incarcerated or parents who are incapacitated, maybe in inpatient treatment.
And additionally, tied to Family First, to really launch a family preservation program so that while children were staying with us in the nursery shelter, we really had the time to intensively work with the adult caregiver in the home to connect to concrete supports and help resolve the crises so children could be reunited in a safe setting.
Next question on here, what best describes the custody status of the children that you serve? Right, looks like most of the votes are in. About 2/3 of us, our parents or guardians, still have custody of the children, and 33% say they serve both populations. I know that there are crisis nurseries in the country that do primarily serve children who have already been taken into child protective services. Providence House really is focused on supporting families before they're reaching that level of crisis where the children would be entering foster care, but we do have a contract with our local child protective services agency where we're able to provide beds for kids who've been taken into emergency custody or have had foster care displacement, and gives the county some opportunity to find the proper foster homes for them while being protected in a home-like environment. I think we just have 2 more questions here. Wanting to get a sense of if your crisis nursery provides services to the families. And this is not an extensive list. I mentioned I could only do 5 options. So if you want to share in the chat any other areas that you might be providing services for, that'd be great to hear. All right, looks like nearly everyone's voted, and majority of us, 81%, more than that, 82%, providing basic need items. A lot of people doing parent education for families using the services. 64% doing case management, and about half doing home visiting and half doing trauma services. I think our core really here at Providence House for our family preservation services is our case management, parent education, and trauma services that we offer. We also have an aftercare program after a family has reunited from the crisis nursery setting, just to provide some extra support. We do group parent education during that time as well, and we started doing some community-based services. Anything coming in that?
Sure. Some folks doing outreach through Parent Cafe, others that are looking toward providing home services to the families.
And then our last question.
Thank you, Holly.
Last question that we're getting, wanted to get a sense of is what % of your current funding comes from public or government funding sources? So I think we're really seeing kind of a broad range here. About a third, little less than a third, less than 5%, then 22% saying 6% to about a quarter, 22% saying about a quarter to half of their revenue, a little bit saying 51 to 75%, and then 17% saying more than 75% of the revenue coming from government funding. Do you want to say a little bit about our history with government funding?
Sure. Providence House, as I mentioned, was founded in 1981. Until about 10 or 11 years ago, we were completely privately funded through philanthropy. Currently, government revenues are coming from predominantly state fund through the Victim of Crime Act funds, as well as some family preservation funds through the Ohio Department of Job and Family Services, representing approximately 25 to 30% of our budget on any given year. So there are a few small county contracts that we've been awarded in the most recent year, but they're negligible in terms of the percentage of allocation. How that aligns with Family First Preservation dollars is those dollars will flow through the state and then down into the counties for administration. And Annette will talk a little bit more about that flow through. These are Title IV dollars, so again, we'll cover that. But currently, we do quite a bit of advocacy along with our partners here in Ohio, Blessing House and Bridget's Path, with our state legislature to allocate funds to crisis nurseries in Ohio, not only for those of us that are operating, but also drafting the language so that as others seek to open, they also qualify, and as a way to encourage nurseries to replicate throughout the state.
Great. So now we're going to just do a brief overview of the Family First Prevention Services Act, just covering some of the basic information. Feel free to ask questions again through the chat or the question option, and Natalie will kind of be monitoring that, can stop me, and we'll pause a couple of times for questions as well. So just looking into kind of the basics of the law, it was signed into law last February, or February 2018. It's kind of the Bipartisan Budget Act. This legislation had existed before then, but hadn't really made it very far. And it was a little bit of a surprise that it came out in this Budget Act. I have heard that they didn't even change dates that were written into the legislation, which is why states are really scrambling to try to meet all of the different parts of this legislation. And it's pretty broad. The biggest part of the legislation is that it gives states and tribes the ability to target federal funds into prevention services to reduce foster care placements. It's really important to mention that these funds are meant to increase and not replace current state funds for prevention services. There's also federal funding for kinship navigator programs. We're not going to go into that too much today, but that's definitely a huge part of the legislation as well. establishes new requirements for placement in residential treatment programs, improving the quality and service oversight of those programs, improving services and lengthening time service is provided for youth aging out of foster care. And the different provisions in the law kind of have different effective dates. Those are really the basics. Looking at the goals of Family First, they really want to promote family-based placements for children in custody. That is, I would say, like the main goal. They want to reduce congregate care placements, and we'll go into what that means. And providing 4E funds for prevention services. Like I mentioned before, these were currently are mostly funds going for board and care, foster care services, being able to shift the funding model so that these can be targeted towards prevention services, and also ensuring the use of more evidence-based practices across the continuum of services provided. So like I mentioned, this is a huge shift in child welfare funding. Most states use federal child welfare funding for foster care related services across the board, pretty much any state you look at. But with Family First, states can begin to shift that focus of providing foster care services for a few to prevention and permanency services for all children in their state. One part that I want to mention that's not our focus today, but that this legislation does allow 4B funds to support reunification services for kids who have been returned, reunited with their parents from foster care, reunified for up to 15 months. And in what the federal government has outlined as eligible services, they included this list. And I'm not going to read all of it today, but you can read it for yourselves here. But it does actually specifically say that it includes crisis nursery services. Would love to hear in the chat if you feel like you support families that have reunited from foster care. I know here at Providence House, we support quite a few families who have previous foster care involvement and had the potential of entering the foster care system again if it wasn't for our services. I think a great example is families who are facing homelessness or unstable housing, unsafe housing, where they could potentially lose their children again to foster care through no fault of their own, just because there's just such a lack of safe and affordable housing here in Cleveland. One thing when I first saw this legislation was I felt that maybe it was going to be an attack on crisis nurseries because they mentioned the goal of reducing congregate care. And I know that that's one stereotype we really fought against, is that crisis nurseries are like orphanages. There's just tons of children in this institutionalized setting. But we've really done a great deal of work making sure that our environment feels as home-like as possible, and really fighting that our crisis nursery model is meant to keep families together and prevent children from entering foster care. But when you dive into the legislation, really what it is saying is that they don't want kids living in group homes that are in the foster care system for years at a time. So they're limiting the Title 4E foster care maintenance payments after 14 days unless children are placed in family foster homes, qualified residential treatment programs, if it's settings that are specific for pregnant or parenting youth who are already in foster care, independent living for kids who might be aging out of the system, as well as residential care and services for those who are at risk or have been sex trafficking victims. States are still able to receive administrative reimbursement past that 14 days, but they can't get that foster care maintenance cost. I realized I didn't plug my computer in to make sure that it didn't die on us. So I'm going to do that.
I can do that while you're.
And we'll keep talking here. So I think that's just really important to mention. As we look into the prevention services piece, this starts October 1, so just a couple weeks away from now. Basically, states must, if they decide to implement Family First this year, they have those new restrictions on the 4E foster care maintenance payments that I just went over, and they are really trying to target children not being placed in those congregate care settings with those exceptions that I mentioned before. At the same time, states can use 4E funds for prevention services. However, these services need to be listed in a clearinghouse, which we'll go into a little bit more detail. And 50% of the expenditures must go to well-supported practices. So looking at that goal of increasing evidence-based practices across the nation, that is their goal, but it's only 50%. So it also leaves room for some of those promising and supported practices that show evidence of being effective. States can delay the effective date for up to 2 years. Most states are doing that. I think maybe only 10 or 11 states have said that they're going to implement this year. And a big barrier to it is the fact that it's a lot of new restrictions that they have on their foster care system, as well as these new prevention services plans that they need to put together. As the clearinghouse has been kind of slow to get up and running, they don't have a lot of services to choose from. I've heard that there's some options for states to put together a plan that includes services that they feel would be listed in the clearinghouse to begin having those payments, but I'm not sure on all the details on that. But this is how the legislation was written to begin October 1st. It's the slide. So who are these prevention services really targeted for? The funds are to go to candidates for foster care. These are children who've been reunified from foster care, adopted, or placed with a legal guardian. And when they say candidates for foster care, the term that they're saying is that they're at imminent risk of foster care placement, which is kind of a broad term that doesn't have a lot of definition around it. So I think that's important to mention. Also, pregnant and parenting youth in foster care, and the funds can go to birth parents, adoptive parents, relative and non-relative guardians of candidates for foster care.
We're asking about the Ohio deferment. Ohio is deferring. Do you know what our launch year is? So 21?
Yes. And I would say, I think about half of the states that they know have deferred, half are going to defer 1 year and half the second year. Looking at kind of the service requirements, the types of services that they're really looking to support are substance abuse prevention and treatment services, mental health services, and in-home parent skill-based programs. This again was something where I was like, oh, this probably doesn't fall under crisis nurseries, but when they say in-home, what they really mean is that the parents still have custody of the children. So it doesn't need to necessarily be services that take place in a home setting. The program funding should last no more than 12 months. It must meet those evidence-based requirements as shown in the clearinghouse, which we'll go into a little bit more. They should be trauma-informed services provided by a qualified clinician. So going into the clearinghouse just started maybe 6 months ago that it launched. They awarded a contract to a company out of Massachusetts called ABT Associates. The purpose of the clearinghouse is really to systematically review research on programs and services that prevent foster care placements, list those services within the clearinghouse for the states to build their program service prevention service plans off of. Those practices must be, like you mentioned, mental health services, substance abuse prevention and treatment, the in-home parent skill-based programs. They're also listing kinship navigator programs within that clearinghouse. The possible ratings that programs can receive is well supported and promising. Programs can also be rated as does not currently meet criteria. Currently in the clearinghouse, there's only 12 programs listed, so that's not a lot for states to choose from who are implementing it this year. There's 21 more programs that have been slated to be the next round of programs to be reviewed. And I think that's kind of the overview of the clearinghouse. They have their own website, so you can see what's in the clearinghouse currently, what they're planning on doing. There's a FAQ section and a manual for how things work within the clearinghouse. We'll go into a little bit more detail about how they're choosing programs and things like that.
And later in the webinar, we will be providing you with a list of resources tied to Family First, including Clearinghouse, and Annette will follow up with participants with hyperlinks to each of those locations so that you can monitor what's happening in the Clearinghouse.
So I think we do have some questions coming in. This has just kind of been a basic overview of the legislation. We're going to go into a little bit more about the opportunities for crisis nurseries, but want to give a chance to pause and address any questions you have about the legislation itself.
So this came through from Holly Beadle. in their state, they retain legal custody for about 6 months after reunification, and the parent has physical custody during that 6-month period. Ohio does not work that way. Licensing in Missouri for crisis nurseries doesn't allow them to serve these families if they are in crisis. They're looking to change licensing to open this up. Do you serve families in this position? Yes. We absolutely do. So while our county does return children to the parent's custody, as soon as the custody hearing is determined, the parent can resume care of their children. We support families through crisis, and currently have just engaged in a contract to prevent children that were taken into emergency custody from sleeping overnight in waiting rooms at our county. So they actually are admitting them to the crisis nursery, and they're staying with us while they and we help family find or foster family find a place for the child to go, so that they are in a trauma-informed safe setting. So there's a soft transition to a more permanent environment. And we currently are having conversations about, even though that child may be transitioned to a temporary foster care or family care situation, how we can work with bio parent to work their plan and provide individual intensive services on top of what the county may be doing, so that we can expedite the reunification pathway.
Yeah. And I would say some of the challenges and opportunities of this legislation are the fact that it's still very state focused. So this is still federal funding that's flowing through the states. States can have very different plans from each other. But the fact that it's a national clearinghouse is what presents some opportunities for crisis nurseries to work together. All right, should we go into? Sure. So really looking at Family First and crisis nurseries, we know that crisis nurseries fit into this legislation because we are an effective approach to child abuse and neglect prevention. One thing that I really love about crisis nurseries is that we've all kind of developed in ways that meet our community's unique needs. So we're a niche service, but most of us are really doing this work that help stabilize families, keep them together, prevent children from entering foster care. We serve families with children who are at high risk of child welfare involvement. So that imminent risk, while it's not well defined, we know here at Providence House that 76% of the families that we served last year do have some history of child welfare involvement, whether that was the parent when they were a kid, their child has had previous open cases, or even had been taken into custody in the past. But we have a lot of success with families, no matter where they fall with that history, of helping them become more stable.
And interestingly enough, when we look at how our families come to us, 70% of our families do self-refer, usually through a recommendation of another family who's used our services. So while we do work with our local CPS, and about 10 to 15% of our admissions are direct referral through CPS on an open case situation, ultimately we see 40 to 50% of our active families are open case when they come to us, and we're discovering that open case situation after the parent has self-referred.
Yeah, most crisis nurseries recognize that we have to go beyond emergency shelter for children, which is kind of how crisis nurseries were originally founded, to strengthen and preserve families. So like many of you mentioned in our poll, you are providing some level of support to the families. And research is showing this. The Casey Family Programs actually has a whole website that talks about crisis nurseries and some of the proven results they have in strengthening and preserving families. And I know Jill Kagan is watching, and Arch also has a lot of lists of research studies that have been done on crisis nurseries showing some of these results. And what the research really shows is that family preservation focused crisis nurseries, this is a term that we've really started using to distinguish ourselves from just crisis nurseries that provide emergency shelter, but those that go beyond and have the supportive services for families do reduce incidents of child maltreatment, out of home or foster care placement, and the time to permanency. So I'm going to go through some of the steps that we've taken here at Providence House to really respond to this legislation and open up opportunities for crisis nurseries. Last summer, there was opportunity to submit public comment before the clearinghouse was published, to talk about what the criteria for the clearinghouse was and to recommend programs that should be reviewed for the clearinghouse. So we did submit public comment talking about our family preservation focused crisis nursery model and submitting some of the evidence we have that were successful. So we completed an external evaluation that was published in 2016, really showing that 82% of the children we served during the study never entered foster care and never were substantiated for abuse or neglect, even years after receiving our services. So that has been published in a peer-reviewed journal, and we included the study and links to that. We also had just done a data analysis with Case Western Reserve University, again, that showed some of the ways that we help increase family stability, connecting families to income and employment resources, making sure that they do increase their income and employment status during their child's stay with us, as well as their access to safe and stable housing. We included all of that research in the comment that we submitted. We also collaborated with other crisis nurseries, Blessing House, which is in Lorain County, and Bridges Path, which is in the Dayton area, to ask Governor Mike DeWine to send a letter of support. He did send that letter this past spring to Jerry Milner and to Alex Azar from the Children's Bureau and the Health and Human Services, advocating that crisis nurseries be included in the Prevention Services Clearinghouse. And we also just, I guess 2 weeks ago, submitted Providence House for consideration for rigorous evaluation through the Supporting Evidence Building and Child Welfare Project. This is something that came about because they realized there really isn't enough well-supported prevention programs around the country that are going to be able to be included in this clearinghouse, and there needs to be more research on projects and programs and services that can prevent foster care placements, and there needs to be more research done to prove that. So we are hoping that this is an opportunity for crisis nurseries to receive further external evaluation and have a better rating within the clearinghouse. Anything you want to add about what we've done?
Nope, I think and that's going to move forward on how we've tried to rally the existing crisis nurseries. This is just a springboard example for you within your own state. So again, we're hoping we can all rally together as a national voice, but within your local state, these are some of the recommended steps that were provided to us out of staff in Senator Portman's office and others at HHS in DC as good steps for you to take, not just at the federal level, but at your state level as well, to get on your governor's radar, get in front of your AG's office, things like that.
Yeah, and I wanted to mention that we did have a great meeting with Senator Portman's office about this legislation and the role crisis nurseries can play in it. And that's where we did receive the guidance about asking our governor to submit a letter and also rallying all the other crisis nurseries around the country to talk about their crisis nursery programs. If we can sign a joint letter together, which you should have received a copy of, that can go a long way in elevating our chances of being considered for review into the clearinghouse, as well as having your own governor submit a letter of support. We received some of this guidance from Senator Portman's office before the manual for the clearinghouse was published, but all of those kind of recommendations are within the clearinghouse, saying that programs are being prioritized if they're recommended by state government administrators, if they've been rated by other clearinghouses, or recommended by another federal agency like SAMHSA or National Institute of Health or any other of those types of agencies. If there's any other steps you've taken within your own state or federally, would love to hear that as well if you want to share that in the questions or the chat. But we can also go forward and talk about what we can do together. So we really hope everyone will sign our joint letter to advocate for crisis nurseries to be included in the clearinghouse. I'll make sure you all get that link again after the webinar, but I think we're at 9 or 10 crisis nurseries now that have signed on to the letter. We also ask that you send your governor or ask your governor for a letter of support. We had the letter that the 3 crisis nurseries in Ohio sent to our governor as kind of a format that you can use, but maybe you have relationships with state administration that can help you as well. The Prevention Services Clearinghouse has also indicated that they'll open up for public comment again this year. So this might be an opportunity for you to share about your program, the impact you've had in your community, include any external evaluations that have been done, as well as any internal evaluations, because those are really what they want to know, is that we're really doing something to move the needle. And they do have some guidance about what kind of external evaluations will be most helpful, that they've been published or done after 1990, that they use random or quasi-experimental service designs, which I know is not too common, that they have some sort of impact on child safety, permanency, or child and adult well-being, which I think all crisis nurseries do meet those goals. Any other questions, or should we? Also, any other ideas that you have, feedback you've heard from your state, things like that. I know in Ohio, state has really been focused on that kinship navigator program and meeting those qualified residential treatment programs. That's been kind of the priority, but we've been meeting with officials down in Columbus, which is our state capital, to start educating about the crisis nursery model, really aligning ourselves to this legislation and opening ourselves up for questions and feedback on how we can be helpful in that process.
And check in, if you haven't, with whoever your licensing entity or your contacts at your state. Many states are forming coalitions that are working on this together. So you want to make sure, if you can get a seat at that table, or at least express your interest in being at the table, is they're figuring out what the continuum looks like state to state. Certainly we're trying to get in the national clearinghouse. States can also define their continuum, and so it's really important that you are advocating at the state level to be qualified in the state's plan that will roll out for their effective year date.
Great. Don't see any questions coming in. There's going to be a survey that comes up after this webinar ends, as well as sent out to you. If you could answer that, if you want to schedule a follow-up conversation with us to address any specific questions or concerns you have, we'd be happy to make ourselves available for anything like that. I also just want to take a moment to talk about some of the Providence House coaching consulting services that we're building at this time. Feel free to continue to ask your questions, and we'll make sure to address them. Here at Providence House, we're really passionate about our model and know that's going to be effective for many communities working to keep kids safe and families together. And we've really developed services to help those who are working to start up crisis nurseries. We've done stakeholder presentations in communities looking at this model. We can help with business and startup plans to help launch new crisis nursery programs. We also can help existing crisis nurseries who are looking to grow their outcomes or want to connect with other crisis nurseries, and I'm going to go into that in a second. But also task force, health systems, public agencies who are trying to figure out how to respond to this legislation and what services to build as part of their continuum of prevention services. And we're really trying to be in front of those organizations and provide services to help launch new crisis nursery programs. But something that we're really excited about and hope this group might be interested in joining us in building is building a national crisis nursery community. So we are starting to develop using an online platform called Mighty Networks, where we would be able to connect with each other, not through email, but kind of through an online community where you can just shoot out questions, get responses. We could have a group specifically set aside for people who are following Family First to continue this conversation, really providing that opportunity for crisis nurseries to connect with one another. We don't really have kind of a national convener, and we know that when we run into other crisis nurseries at conferences, there is so much great discussion that happens, and so many crisis nurseries that are kind of just randomly reaching out to each other with questions. We think that it'll be really beneficial to have kind of a community where we can come together and talk and have really great conversation. We also see this as a platform where we could have some of our learning and coaching services that I mentioned before, but we can also host ongoing conversations. We could decide, hey, next Thursday at 11 a.m., let's all talk about issues that we have with staffing. I know one time when I talked with Crisis Nursery, they were saying, we're not even sure if we should call ourselves a crisis nursery anymore. And we thought, oh, we're having that same conversation. So just things like that come up when you're talking to like-minded organizations and having that platform to talk to others about it with. what we are really hoping you might consider is becoming an early adopter, helping us build some of that initial content, the groups that people would want to see in this kind of community and would be engaged in, so that as we invite others to join the community with us, they can really see what it's all about, and you can share your perspectives, your best practices. We can all really learn from each other. So within the survey, there's an opportunity to sign up to kind of learn more, or to just raise your hand and say, yes, I want to help you build this. And I'll be reaching out to kind of continue that discussion.
And the goal here is really that it is a public forum, so that, you know, even if you're looking for some technical assistance, you can go in and follow a thread, as Annette said, on staffing or volunteer management, where there may be some online content that you can download, but you can also see the conversation going around among nurseries, where a lot of us are doing informal technical assistance, and it's phone call by phone call or email by email, and we can really work together to share information and best practices.
So here are some of the resources I mentioned. I'll just run through this list. The first is familyfirstact.org. If you haven't visited this website, it's the one-stop shop to really learn about the legislation, the new things that are coming out, different things that researchers have been talking about with it or have been publishing about Family First Act. You can sign up for email alerts about different things. The Children's Defense Fund also together a really good implementation timeline, really talking about when all those different parts of the legislation will take effect. I mentioned the Casey Family Programs has a website on crisis nurseries in the Family First Act. Of course, the 4E Prevention Services Clearinghouse. And there's also access to our public comment advocating for the inclusion of crisis nurseries in the Clearinghouse, our letter requesting support from Ohio Governor DeWine, as well as our National Crisis Nursery Joint Letter. And in my follow-up email, I'll have nice things that just say click here and make it really easy for you to access them. And we'll also give you a copy of these slides as well if it's helpful.
So that's pretty much our content for today. I don't know if anyone, I'm watching, monitoring for questions. I don't see questions coming through. We do hope that you found it helpful. As Annette said, she will be doing a follow-up email to all of the participants today, and the webinar will be posted to our website as soon as we've downloaded the content. Should you have any additional questions, our contact information is here. It is also on the webinar page when the content is loaded, and Annette will be the direct follow-up for all the links and resources that you may have. We do hope that you will sign on to the joint letter supporting crisis nurseries in the National Clearinghouse, which just further strengthens your chance that you'll also make the state list in your own local state, and also that you will join us in the national community online and begin to communicate, collaborate, share ideas, resources, and maybe some technical assistance with each other. So we really appreciate your time. We'll keep it open for just a second or two longer if folks do have some additional comments or questions. Annette, do you have anything else you would like to add?
No, I hope we'll get to connect with each one of you soon. If anyone is going to the Prevent Child Abuse America conference next week in Milwaukee, I'll be there. So if you're going to be there too, would love to connect in person. Just shoot me an email and we can figure out a time that works best. We'll give you those 15 minutes or so back in your day, and we really hope that this has been helpful for everyone.
And we will be presenting a few more webinars. Some of them will be on the progress of Family First, as well as some of the other peripheral issues around family preservation focused crisis nurseries and some of the transformation steps that you might want to be contemplating to further align with Family First. So stay tuned. We'll continue to communicate with you via email and through our website, and hopefully soon through the national community that we can launch. Have a great day.
Thank you, everyone.